I've been with the agency for about 5 years now, so I'm your servant for the next couple of minutes. So I'll talk to you a little bit about the services of the agency and the mission. Next slide. Oh, so we do the next slide instead of clicking? All right. Been with the agency for about 5 years, started off as a volunteer. And so the RAICES project has a team made up of our evaluation consultant, Greg Van Hyte, which the gentleman back there, and Emmanuel Garcia, who's our project coordinator. Then we also have the peer advocates, Reyna Oritz, who's going to be a member of our town hall, Christopher Avalos, and Nubia Velasquez. So let's give them a round of applause. All right. So a little bit of Project Vida's background and mission. Our mission is to improve quality of service and reduce health disparities in underserved communities by promoting self-empowerment and providing holistic health education and direct services, right? So a little bit of the programs when it comes down to prevention services, the programs that I manage with the team of awesome people, Tony, Emmanuel, and Josh. Our crew, Committed, Responsible, United, which has a target population of young MSM, young men who have sex with men ages 12 through 24, whether they're Latino or African American. But at the end of the day, it's all inclusive, right? So because we're targeting something does not mean that we're going to turn away somebody that may be in need of services. RAICES, resources, advocacy, inclusion, community education and services. This is why we're gathered tonight. Tribe, who targets a population of adult Caucasian MSM, men who have sex with men 25 and older, in the Wicker Park area, so around the Wicker Park, Logan Square. Get Your Life, which is a prevention with positives program that targets individuals that are HIV positive 18 and over or through 24 in the Hyde Park area. So that's actually a program that up and running, which I'll be leaving after this to go to Surgery Hospital to help execute the program, which is actually running right now. So we also are newly funded for the African American AIDS Response Act prevention program, which is going to be a program that's launching in the Austin community. So we're working directly with Austin CDC to target high-risk individuals as well. Direct services, we offer case management, mental health counseling, psychosocial support groups, wellness advising, case findings, acupuncture, massage, and herbal medicines are alternative forms of therapy and services for clients that may be affected by HIV/AIDS. But it's not only to clients, right? Acupuncture and massage is also available for the community as a wellness center. And lastly, we also offer food pantry services to clients that qualify that may be, or that actually are affected by HIV/AIDS. So that's a quick overview, quick and dirty overview of the agency and the services that we provide. I believe this is where I say probably click and introduce Emmanuel, who would help put this together, actually.
Yeah, I don't know how many. So just a little bit briefly about RAICES. RAICES started in 2012, and it's a project to address stigma of HIV, homophobia, and transphobia in the communities of Cicero and Berwyn. We basically have the poster that's back there that we launched early last year, which is the fishbowl image, and that talks again about homophobia and transphobia and the inclusion of LGBTs in our community. So we've done a lot of programming like this to engage community, to have these conversations, and we also have a training that we do that's called the Let's Talk About Sex and Gender training that we do with youth. We've done it with over 250 Cicero youth, and that again addresses the issues that are important to the LGBT community in that training. And one of the things that happens in that training is that people, at the end, we ask them, what do you want to know more about? And all the time, it just without fail, trans issues is what they want to know more about. These are youth speaking. So a lot of our programming is really a response to what the needs are in the community. So we've tailored a lot of our programming to fit those needs, right? To address those needs. So one of the things that happened earlier when we applied for refunding was we were talking about, well, what do we want to prioritize in this project? And so doing this focus group was really important for us, so that, you know, these are issues that the trans community lives every day, and that this experience is not new. So the information that you're going to see today isn't new. It's not. It's something that's very real to people's lives. But it is important to have it on paper in a document in order to, you know, creatively think of what to do next. So that's RAICES for you. Is there another slide? And okay, so I'm not doing a Trans 101, but I do. There's a couple people that on your chairs, you have something underneath. Can you check your chair if you have a label? And then I'll call you. Okay, so who has, okay, you have one, Mona has one. Okay. No, it's not there. Oh yeah, if it's a piece of gum, please look at it. It looks something like this. Okay? Alright? And if it's not on your chair. Alright, so this is the way. So Tony, you have gender identity. Okay. Okay, you have transgender. All right. So this is this is what we're gonna do. I don't want to call anybody out, right? So what I want is I want you to present the word to the group, to the space, right? And you can either attempt to give us the definition, or you can throw it out to your community and have someone else give us the definition. So I'll start with Antonio Lizando. You have gender identity.
Gender identity, and I think it's whatever a person identifies as, like gender that they personally identify with. And I'll throw it out to whoever else wants to go elaborate on that.
Gender identity? Anyone want to add a little bit more to that? So gender identity, thank you, is an individual's innermost sense of self as male or female, as lying somewhere between these two genders, or as lying somewhere outside of gender lines altogether. That's gender identity. Thelma?
I'm transgender.
Transgender.
So I believe it is a person who is born either male or female, but identifies as a different gender.
After birth. Does someone want to add something to that? Sure.
I think it's also an umbrella term that covers the full range of people who gender identity and expression conform to the norm.
Yeah, it's exactly. So transgender, an umbrella term for all for all who feel that they are outside the boundaries of biological sex and culturally determined gender expression. So it includes transsexual, two-spirit people, and people who do not identify with their biological sex. Thank you. Who else has one? Mona?
So I have sexual orientation. I think it means who you're attracted to. You could be attracted to both male and female, or you could be attracted to female, or you know. So I think it could be an either or it could be a continuum of who you're attracted to.
Yes, I love that. Someone should have typed that out. Sexual orientation, a feeling of attraction to others based on biological sex and gender expression, over which individuals have no choice, and different from sexual behavior, romantic, sexual, and emotional attraction to others categorized by the sex of the person to whom one is attracted. So it's interesting because when I talk to youth, I ask, do we all have a sexual orientation? And everyone's like, no. Like it's only gay people and lesbians, you know? Because we use that word a lot to talk about LGBT, but we all have a sexual orientation, right? So thank you. Is there another one? Does someone have another word out there? There's a couple. Is there one underneath the chair next to you, maybe? Oh, there it is.
Gender fluidity?
Yeah, gender fluidity. Yeah, they're just presenting later, no pressure.
Oops. I'll throw it out there to somebody else.
Could you hold it up?
Gender
Gender
fluidity.
fluidity.
T-Y.
Oh,
D-I-T-Y.
does someone want to take that? Okay. The belief that social constructions of gender identity and gender roles lie along a spectrum and cannot be limited to two genders, a feeling that one gender varies from societal notions of two genders, gender fluidity. And there's more, and this is part of the Let's Talk About, this is the first exercise that we do when we do this with you in our Let's Talk About Sex and Gender, and there's so many definitions. It's a game. Basically, they turn the definition, and then they are challenged to come up with their ideas of what they think those terms are, and then we explain what they are. Obviously, the training is a 2-hour training. It's not just the vocab, that's one piece of it. But I wanted to cover these words because we're going to be hearing a lot about these words today. Someone said something?
Yeah, isn't that just the word for bisexual? Gender fluidity?
No. Well, that's another word. Bisexual. So, without further ado, you're going to get a lot of information today. I just want to say I'm so proud of Reyna Oritz, who helped put this together with Greg. And this was really a labor of love and dedication that we really wanted to get a group of trans Latina women together in a room and do this focus group, and now we're presenting this information. It will be available. Everybody who signed in is getting an electronic copy, but we also have hard copies for you to take. It's good reading material. Share it with people. Let's engage. Let's start this conversation. And we're in a safe space of learning right now. So a lot of times in our community, we don't get the opportunity to ask questions. Whereas we're activists talking with activists, and it's assumed that we're supposed to know everything. And so there are no wrong questions. So after they do the presentation, we're going to have a panel discussion, kind of a view style, where I'm Barbara Walters. Anyway, so without further ado.